This sign gives special comfort to the millions of women with incontinence, uncontrollable leaking of urine.
It's kind of a hidden thing that people don't want to talk about. It's socially embarrassing for a lot of our patients.
At her clinic at Tufts Medical Center, Dr. Ferzandi sees many women over the age of 40 with incontinence. But she also sees many younger women, especially athletes and others who are physically active.
You don't need to, quote, suffer in silence because it affects their quality of life.
There are two major types of urinary incontinence. The first, stress incontinence, is the leakage of urine with activity, like exercise, laughing, or even sneezing.
I was in my early 60s, but when I went like for a long walk or any kind of thing, I could not hold it. It just kept coming out and coming out.
For years, Rosemary Lyons managed her incontinence by using sanitary pads. She eventually decided it was bad enough to talk to her doctor.
I'd go to work and have to change it 2 or 3 times a day. You know what I mean? It was like a constant thing. You couldn't get away from it.
Rosemary had a sling procedure, an outpatient procedure where a thin synthetic tape or sling is inserted vaginally under the urethra to help support the base of the urethra and prevent leakage with certain activities.
How are you doing?
I'm doing great.
The sling is best used in women who've completed their childbearing. After placement, heavy lifting is not advised until the tissues have healed.
The efficacy or cure rates are excellent. They're 85 to 95%. Patients are very happy.
I was operated on outpatient on like a Wednesday, and I was feeling good by the weekend. When I say feeling good, I had no pain, nothing. Felt good, haven't had any problems.
Another treatment for stress incontinence is a Pessary, a ring-shaped device that's inserted into the vagina for urethral support. Some women can manage their own pessaries at home, while others come in every few months to the clinic to help them manage it. The other major type of incontinence is overactive bladder, or OAB. Women with OAB have a sudden urge to urinate and may sometimes leak urine. They may also feel this urge frequently, even when their bladder is not full.
They get that sense of having to go to the bathroom, but when that sensation occurs, they need to go. And sometimes they may not be able to contain that, and they may actually have an accident trying to get to the bathroom.
Treatment for overactive bladder starts with a patient completing a 3-day diary and measuring her voided urine.
Based on those diaries, we can talk to them about changing and modifying their behavior patterns, their fluid intake. A lot of people feel very worried that we're going to say, oh, you have to stop drinking. And in fact, what we do is we encourage them to drink, but the right types of fluids, and we moderate them during the day.
Other treatments include physical therapy, medications, and sacral nerve stimulation via interstim therapy, particularly appropriate for those who also have fecal incontinence.
A lot of my patients lovingly call it the bladder pacemaker because it indeed looks like a pacemaker. And what we do is we place it in the operating room under fluoroscopy, and we literally take this little electrode and stimulate the nerve that we know feeds into the bladder. We've had some really good success with that as well.
Another option, Botox injections.
Yes, it's the same kind of Botox, the same family that people use for wrinkles, but it goes in the bladder. And we do that with a tiny little camera and inject it in all these spots. And if you think about what Botox does is it calms things down. It calms the wrinkles down. It smooths out muscles. And the bladder is a muscle. So by putting Botox into the bladder muscle, it calms it down.
Yes.
Whatever the cause of incontinence, there is a way to treat it. The first step is talking to your doctor.
For me, it was like a new lease on life because I didn't have to worry about going to the bathroom. I tell everybody it's unbelievable. I just can't believe the difference.